Today we're going to talk about spinal disc health, and we're going to connect the dots between a healthy disc and what that looks like on x-ray and a non-healthy disc space and what that looks like on x-rays. But before we do that, let's zoom out and let's talk about the problem that we address here all the time and the problem that I see. Here's what happens. Accidents and injuries tear loose the connective tissues which hold the vertebrae together. This creates a weakness, and then the structures begin to break down, the spine gets stressed, the misalignment occurs, and the vertebrae get locked into a stressed position. You can still move and get around, but the stress is always there. And it's evident when we do our exam. For example, one leg may be shorter, one leg is longer, one hip is higher, one hip is lower. There's uneven muscle tension side to side in the spine, and it's usually predominantly on one side way more than the other. And this creates a difference in the bilateral weight many times. It's a progressive degenerative condition. Nerves are compromised, functions are limited, and the structures break down. Let's talk about those structures, specifically the intervertebral disc. Now, a healthy disc space on x-ray, referencing this chart over here, should have a nice, smooth contour of one weight-bearing part of the bone, not the back part. And by the way, this is the part that you can actually feel. And to reference, this is a lower back model. Nice healthy disc space, even pretty much from the back all the way to the front. And that's what it would look like from the front to the back. But what happens is when there's the misalignment, the center of gravity is going to be altered, and then the center of motion is going to be altered as well. And this can create wedging of the disc and eventually bulging, like you see right there. Disc is starting to bulge forward, bulge out to the side. See that wedging starting to occur there. And this eventually leads to protrusion, where the center nucleus of the disc starts to break through the cartilaginous ring-like structures, just like the ring on a tree, and it gets weaker and weaker. The vertebral disc can begin to crack and dry out. They call this desiccation. And then if that's not corrected, unfortunately, it can lead to protrusion and herniation and full-on rupture. The disc material is going where it should not be. This is no longer a chiropractic problem. This is a medical emergency problem that needs surgery. And over time, we can see the evidence of this on x-ray. We call this phase 2 spinal degeneration by the time there's bone spurs starting to form. And you shouldn't look like this until you're about 100 years old, where there's advanced osteoarthritis, the bone gets really weak, osteoporosis ensues, and unfortunately I see people that are in this position even when they're in their 60s, even in their 50s oftentimes. So the only way of knowing for sure what the quality of your disc spaces are is x-ray, MRI as well, but x-ray is the most non-invasive way of finding that out. And then the plan from there is to conservatively correct as much as we can your alignment so you're dealing with gravity once again. Because remember, let's backtrack. The misalignment and then the center of gravity is off, and then the center of motion is off, and then it eventually can become a disc problem. So if you go to a medical person, you have medical tests done, they're going to, through a certain lens, they're going to see reality, and they're going to say, well, you need to have this potentially type of invasive procedure, or you can take this. We might refer you out to physical therapy, in which case, unfortunately, and nothing against physical therapists out there, but what happens oftentimes is it'll actually grind down further on the existing problem because they're treating oftentimes the problem that the medical doctor had diagnosed, which is a problem at exactly this 1 or 2 levels without even zooming out and looking at the whole entire structure and how it's dealing with gravity, that principle of gravity, that law of gravity. It's not just a good idea, it's a law. Now please bear in mind, chiropractic, upper neck based chiropractic, any chiropractic is not a treatment for disc conditions, and certainly if a person has this going on, that is an emergency. But most disc problems can be conservatively managed as long as we're proactive and we get out in front of potential problems. And the only way to know that is to pop the hood and to see exactly what the quality of your disc spaces are. So who do you know that hasn't had an x-ray on their spine in a while? Someone might say, oh, I know my spine is good, I feel great. Well, how do you know that if you haven't seen it? How can you know if you have healthy teeth unless you go to the dentist and they do some imaging to see what the actual health is of the gums and so forth? So it's the same thing in the chiropractic world. We have to be able to see it. To not see it is to guess, and we certainly don't want to guess about your spinal health.